Okay, we're back. So I just gave everybody their food, and I'm back. And everyone's right. This is really fun, especially in this quarantine time. Like I said earlier, my husband has my computer, and which means he also has my bedroom because that's where our office is. So my other choice is the living room, which is right next to my mother-in-law's room, who cannot hear very well. And so it's extremely loud. The TV is just turned up. I wouldn't even be able to hear my own thoughts if I tried to watch TV in there. And then, of course, my daughter has her own room, but I'm not going to invade her space. So this, during the hours of, I think, like 8:30 to 5:30, is my personal space. Or, yeah, that's pretty much it. Or just whatever. I don't have any options. We have like a dining area, but it's, I hang dry a lot of our clothes. So that's where like these hanger things are. Anyway, so I've already done my first review. So exciting, which was on the Chick-fil-A cold brew vanilla coffee. I added that creamer that I was talking about in the other video, and now it's perfect. And now I am trying, let me get my water. It's like a Chick-fil-A, it's like their egg bowl. So it's got eggs, hash browns, and chicken in it, which the concept of eating chicken and eggs together always freaks me out a little bit, and I don't know why that is. It just seems weird to eat chicken and then eggs. You know what I mean? I don't know. I'm a weirdo. Anyway, so I'm eating that. I had to put tomatoes in it because they add moisture, and I have, because of my condition, which is called small fiber neuropathy, I can't remember if I mentioned that, part of one of the many issues that this condition causes, shortness of breath. So I'm always air hungry. And then, why am I hot? Like, the air's on. I don't understand. Anyway, and then this constant burning mouth. So it feels like if you just ate, something spicy. You know how you can feel it on the outside of your lips, like the inside of your lips, the roof of your mouth, the insides of your mouth, your entire tongue, your throat. All of that is just in a constant state of burning. Plus, I have really bad dry mouth. Some might refer to as cotton mouth. And those of you that, you know what I mean, know about dry mouth, or even if you're just using the gummies. I think for me, I've tried CBD, and that caused really bad dry mouth too, so I couldn't continue on with that because it just takes what I already have and makes it a bazillion times worse. So I added tomatoes for moisture because I can't eat anything spicy, anything with any spice in it at all. Again, takes this past, it's already like a 10. Like, this is, in terms of mouth burning, this is the worst. It takes it to another level. So, that's why I can't eat anything spicy. So I have to be very careful. So I added tomato to it. I think there's cheese in here. Everything's probably soggy now, like the hash browns, because I added tomato, but it's what I had to do. So, anyway, let's give it a shot. It's also really cold now because I spent all that time getting everyone else their food and then grabbing all my stuff so I could sit out here and talk to you. And everybody's right. it does kind of feel like you're talking to somebody else. You know what I mean? And it's not like I don't have people I could FaceTime. I don't have a lot. And I can get into all that later. Why I don't have a lot. I have a lot of sad stories. But sad shit makes you stronger, right? So, but anyway, I wanted to talk about why my whole point of wanting to start this channel. I think part of what I talked about earlier, hold on, was I'm sorry, I took way too big of a bite. I wanted to bring awareness to my particular chronic pain condition. It's called small fiber, F-I-B-E-R, neuropathy. And if you don't know what neuropathy is, somebody in your family either has it or knows somebody that has it, because there's many different forms. The most common is peripheral neuropathy, where you have diabetes and it can cause numbness and tingling in your hands and in your feet, like your extremities. Sometimes so severely that your feet will get numb or whatever, and you'll step on a tack or a nail or whatever, or you'll cut your foot and you won't feel it and you won't know. And then it'll become infected. Or the tissue's just dead from no circulation. So that actually happened to, I'm so sorry, I get really bad shortness of breath when I try to talk, but I want to talk. I want to just lay there and watch freaking TV all the time or whatever. So if you would just bear with me, I'm doing the best I can. But my particular kind of neuropathy is an autoimmune. Something autoimmune in my body is causing it. And it's called non-length dependent small fiber neuropathy. So for me, that means it affects my entire body. From my toes to the tip of my head, tips of my fingers, everything. And that also includes my organs. So it's the small nerve fibers that are being destroyed or are destroyed. They don't know. They know some illnesses that can cause it. Diabetes is one. I don't have diabetes. I know some of you out there who watch this might look at me, my gorgeous 50-year-old figure, and think, oh, she's overweight. She must have diabetes. I don't. I also have excellent blood pressure. Always have. Very low. And they've tested me for everything under the sun that could cause it. Sjogren's syndrome, which is an autoimmune disorder, lupus. And the symptoms themselves are very much like MS. If you go to an MS Facebook group or a small fiber neuropathy Facebook group, and you see all of them talk about their symptoms, they're identical. Except there is a version of MS that is very progressive, and it can, unfortunately, some people lead to where they can't do anything, like literally anything. They can't move at all. And so, yeah, that's, I mean, just to even think about that is awful. Even though movement is extremely painful at times for me, I still feel grateful that I'm able to do that. And there's some days that I'm not. But it's taken me a long time to get to this place mentally. So if you're in the beginning of your journey with small fiber neuropathy or anything chronic pain or chronic illness related, and you find yourself just angry and bitter, that's okay. I think that's part of the process. You know, oh God, when did I get diagnosed? I think it was in 2015, so I was like 45. My first grandbaby, I'm going to call him Hippo. I'm not going to use my grandchildren's real names, just because I don't think it's appropriate. So, that's his nickname. Anyway, when Hippo was born, I had just been diagnosed before he was born, and I got really angry and really sad because I remember all the things. I have 4 kids total, 3 that are my own. The other one is my stepdaughter. But we've had them all since they were babies. So I remember, you know, how my mom would take my sons a lot, all the time. And all the energy that she had to take them places and do things with them. She basically was like a second mother to them. And I knew, just based on what my body was doing and what I was dealing with on a daily basis. And the kind I have is progressive, unfortunately. Unfortunately, they don't know how progressive. When I first was diagnosed, they were like, I mean, they literally, I asked them, which I can't think of the word right now. Oh God, what is the word when it's like, this is part of the problem. I get brain fog and I can't remember shit. Oh God, I'm so sorry. What are things look like for me in the future? Like, what's going to happen? You know, most of the time, when you're diagnosed with a specific disease, they can tell you the trajectory, what you can expect. With this, even though it's actually not it's not uncommon, nobody knows anything about it. At least 5 years ago when I first got diagnosed, thank God I had a neurologist that knew about it. I told her what my symptoms were, and she was like, hey, I'm going to test you for small fiber neuropathy. And she did. And the way they test for that is they take, I think it's like a 3mm punch biopsy, skin punch. And she took it into 4 different places of my body, 2 up here and then 2 on my legs. And they check the density of the small nerve fibers. And mine were gone. Like, you can go look up pictures of what it looks like under a microscope, and it'll show you, okay, here's a normal, and it's just a bunch of little squiggly, they kind of look like varicose veins or whatever, little squiggly lines. And then they'll show you someone with small fiber neuropathy, and it's just empty. It's just like a blank slate. And for whatever reason, I don't know why, doctors are just very flippant and dismissive when you tell them you have it. I think, one, because they don't know what it is, and they don't want to admit, hey, I don't know what that is, or be, act curious or ask questions, because maybe that will call into question how good of a doctor they are. I don't know, but they've always acted like it's no big deal. And, I'm like, probably a lot of it is because nobody knows anything about it, which is one of the reasons I want to do this channel, is because I want to create awareness. We don't have a lot of representation for small fiber neuropathy patients on YouTube. I was only able to find a couple in all of YouTube, and that was the last time I looked, which was like a year ago. And at that time, I just was not in the frame of mind to watch those videos or even make my own. I went through a really long period of being angry. I think a lot of that is because I suffered long time sustained abuse when I was a kid, from the years of 4 to 11. Not my mother. My mother did not participate in that. And it was not my birth father. It was the asshole that adopted me. And yeah, so I was bitter because I really had convinced myself that, okay, well, I've already been through my bad thing. You know, everybody has to deal with something bad happening in their life, right? Like, you don't get out of this life scot-free. Nobody does. Having had a perfect life, you know, and dying unscathed. Nobody does. But with something so severe and terrorizing for 7 years, you know, dealing with something like that at such a young age, I just felt like, okay, you know, I've paid my dues. I've gone through the bad shit. Like, obviously, semi-bad shit, you know, is going to happen. Losing your job, a divorce, whatever. But nothing like that. And so then when I got this, when I was diagnosed with this, I was like, I was just really confused. I was like, no, like, I already went through my bad things. So, and I didn't realize at the time when I was diagnosed how bad it was going to be. Like, I knew how bad it was, but I kind of thought, okay, well, once I get a diagnosis, which you have to fight for, you know, I didn't get one right away, but I finally did. And I can talk about that on another video. Anybody that's watching this, if you have questions about a specific thing, just ask me and I'll make a video about it, because I know I'm all over the place and I apologize, but that's part of having small fiber neuropathy, part of fibromyalgia, which is caused by small fiber neuropathy. It's not the only reason, it's not the only cause of fibro, but fibro is one of the things that small fiber neuropathy causes. It's partly the hypothyroidism, which could be Hashimoto's, but I'm being tested for that. And that could be the autoimmune that's causing the small fiber neuropathy, because the small fiber neuropathy is just a symptom. At the end of the day, it's just a symptom. There's a bigger picture. There's something else causing it. So, but, you know, at the time, I didn't know what it meant. I thought, okay, well, now that I'm diagnosed, I'm going to get medication and they're going to fix it and I'm going to go back to my normal life, which was at the time living a full-time job. I was done raising all my kids. My daughter, I'm so terrible at math. My daughter was right in her last year of high school. So it was just that last few months where we were really pushing to get her graduated. And that was a struggle, which was the same for me. I always struggled academically. And, excuse me, when it was over, I was like, yeehaw, like, my husband and I can finally go do things that we've been wanting to do. Go on little road trips. Go to, you know, parks and museums and zoos or whatever, you know. Just travel as much as we could financially or whatever, as cheaply as possible. But we wanted to be able to do that at the time, when I was having symptoms, not when I was diagnosed. I didn't know I was going to have a grandchild. So I was just planning on like, okay, we're going to figure out what's going on with my body. Get that fixed. I'm sure it's nothing. My daughter's going to graduate soon, and it's finally our time. Because I started having kids when I was like 21. I had my first kid when I was 21. Don't regret a thing. I love being a young mom and a young grandma. Or so I thought, but technically I feel like I'm about 80. So anyway, I got diagnosed, and I was like, okay, well, you know, I'll get medication and it'll fix it, and give myself time to recover, and I'll be fine. The medicine doesn't fix it because there is no treatment. There's pain management, and I wouldn't even say that it would be a joke to say that any of the medication that I get manages the pain. If I were not to have any, I would be in bed right now crying. There are days, sometimes weeks, where the pain is so bad, I can't walk. And just laying in bed is excruciating. And there's nothing that you can do. Nothing you take, nothing you do fixes it. Let me tell you what it feels like. Now, for a lot of people, there's two different small fiber neuropathy patients. You've got, excuse me, ones like me who, so sorry. Ones like me that, I have mostly muscle pain. So, it's a constant tension in your muscles. So like those of you that work out, and I'm sorry, I got to take my medicine. I've been a little busy this morning, so I haven't taken any of my medication. That's where I keep some of my stuff. Hello. But anyway, yeah, I haven't taken any of my meds today, so I'm taking Advil. Also, let me just say, I am not a doctor, so I can answer questions about my experience. But if you are experiencing any of your own issues, I implore you to seek assistance from your doctors, and push, and don't give up. And if you get one doctor that says, I can't find anything wrong with you, go find a different one. Fire your doctor. Fuck them. If you're a doctor, thank you. I appreciate your work. But if you're an asshole doctor, stop it. Stop it. People, you know, people need you. There's no reason to be a dick to your patients. I had one guy. Let me give you an example while I'm getting my meds out. So I went to a rheumatologist. I had already a few years of this pain bullshit. And I was seeing my neurologist, and she hadn't been able to find anything that's wrong with me. I mean, in terms of like what's causing the small fiber neuropathy, which was frustrating because I wanted to try this therapy called immunoglobulin. I don't know. It's called IVIG. It has something to do with plasma. And I wanted to try it because everything that I've read, I have spent 5 years, sometimes spending days on days doing nothing but just studying up on this, reading, research studies and all of that. I'm on many small fiber neuropathy groups. And I've learned, I think, as much as you can. I know more than a lot of doctors that I've been to. And hold on, I got to take my Advil. sorry, it's very hard for me to swallow the drugs because I have hypothyroidism, so my thyroid gland is swollen, and it makes swallowing pills harder, but also having an extremely dry mouth makes swallowing pills very difficult. So, yay me! And again, I lost my train of thought, but what I think I was going to say is I'm not a doctor, but if you're experiencing issues, just fire your doctor if you're not getting what you want. If you're not getting the tests that you want to get, and you have insurance, and you can pay for these tests, and they're just like, nah, you don't need this. Tell them, like, I have the insurance. You know, sometimes doctors will assume on your behalf that you don't have the money for an MRI or a CT scan or whatever. Maybe they'll assume that you can't afford or don't want to pay for the deductible, because a lot of patients do complain about that. I know. I've been working in the healthcare community for many years now, and I understand that. But if you don't mind paying the deductible, or if you've already met the deductible and you want that MRI, you want that CT scan, push for it. Insist on it. And if they don't want to do it, tell them, I'm going to find another doctor that will then. Then maybe they'll say, okay, fine, I'll order it. If not, fire their asses and find somebody that will, because you will find somebody that will. And only when you keep pushing will you get the answers that you need. And sometimes the answer will be, we didn't find anything. But you know you. Don't let anybody think that you're crazy. I went to so many different doctors because I had so many things going on with my body for years before the event that got me to the neurologist. Because there were so many things happening all over with my body that would happen one day and not happen the next. And, you know, I just blew it off as, oh, I'm aging. Oh, I'm getting older. Oh, I'm overweight. Oh, la, 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 you know. And I didn't, you know, there wasn't a lot of self-care on my part. There just wasn't. You know, a lot of that goes back to mental stuff from growing up with abuse and all of that, and self-esteem issues. But also just, I kind of grew up like that, you know, doctors it just wasn't a big thing. It was suck it up and go to school. You're bleeding out of your eyeball? I'm sorry, honey. If you keep bleeding out of your eyeball, then go to the school nurse and then I'll take you home. I'll take you to the doctor. Growing up in the 80s, I was born in the late 60s, but growing up in the 80s, you were a latchkey kid. I think I read a study that said we were the most under cared for generation or something like that. I don't know the right wording or terminology. Sorry. I've got 3 different things, and don't come for me about the Advil. I have to. If I don't take it, then I'm laying in bed in pain. Now I'm already in pain, but it's a different level. And so I need this combination. I finally found a combination that helps me not want to die. Okay? So, I do what I have to do, and I understand that's not good for you. I understand it's not good for your stomach, long-term damage, all of that. But it is no life when you're living a life of constant, unending pain that is like a level 8, 9, 10. And you know, when you're a chronic pain patient, you get a certain baseline where back in the day before I had this, you know, a woman, you constantly walk around with a pain threshold of about 2, right? Because cramps or whatever. And because you're a woman, you just have to go on about your fucking day. Like there's no excuse when you're a woman. You have to do it all. So sorry. So anyway, I take Advil. That's it. So I think what I was saying, I've gone on so many tangents. Push to get answers. It does not mean that you are a hypochondriac. It does not mean that you're crazy. I know you feel crazy. I know that people in your life might treat you like you're crazy, or like you're seeking attention, or like you're a hypochondriac, because one day you're talking about this, the next day you're talking about that. And they're like, dude, yesterday it was your foot, today it's your hands, last week it was your thighs. Like, you know, and the doctors can't find anything wrong with you. You go to the doctor, they take your blood, they look